Sam. I'm your occupational therapist. Can you tell me what brought you in today?
Yeah, so I've been experiencing some persistent tingling and numbness in my fourth and fifth finger for about 2 months now, and my neurologist told me that the ulnar nerve is compressed at the cubital tunnel, and she gave me an order to get a custom orthosis to wear at night.
Awesome. All right, so what we're going to make for you is called a elbow flexion restriction orthosis. The material is made out of something called Orthosis Natural. It's 1/8 thick. It conforms pretty well and has memory. It has minimum to moderate resistance to stretch, as well as it'll just work better at night when you are moving your arms. It'll hold it into slight flexion.
So I won't be able to flex my arm all the way. Okay.
Yeah, so that's the way it'll work. By not being able to flex your arm all the way, it only keeps it in about 20 to 30 degrees. It prevents the compression at that cubital tunnel when our ulnar nerve is running. Okay, so the way this is made is we have 3 straps, and these are just Velcro straps. There's one for the wrist, the elbow, and the arm, and we also have numerous pads to protect the bony prominences and also where you can have more comfort, as well as additional Velcro brand sticky hooks for the straps. And then right here for your olecranon, we have this additional padding, and this will help that bony prominence. And what it is there's hooked Velcro that's in between this. We heat it up, and it sits like in between this Velcro strap and this additional padding. That's how it all sticks. Okay, so the way you make this is you measure the arm, and you place it on patients. So measure from glenoid head to the wrist, and make sure it covers at least half the circumference of the whole arm. And again, like we were saying, 20 to 30 degrees. Okay, so you can go ahead and I'll show you how to put this on first. So it's going to go on right there. Then the 3 straps. And again, you're going to want to follow those orders set by your neurologist wear this at night. It'll help out, okay? How does that fit?
It fits pretty good.
So we're going to go ahead and take this off, and then you can try putting it on.
Okay. Would it be easier if I had these straps already on and then pulled it towards me instead of around my arm?
Whatever is easier for you and just more comfortable.
Okay. Can I try and see if I can do it the other way?
Yes.
And I probably want all the Velcro covered, right? Because I don't want it catching on stuff.
Mm-hmm.
Okay.
And we did cut it. Perfect.
Oh, that was a lot easier to do it that way.
And do you feel comfortable doing this and wearing it at night on your own?
Mm-hmm.
Okay, awesome. At home, there's a couple different ways you can clean this. You can actually use like a Clorox wipe or just like a wet paper towel. Just wipe it down and then use a dry one and wipe it afterwards. Don't put it in the dishwasher at all, and make sure you take it with you out of your car. Don't leave it in your car because it can melt when it's warm out.
Okay.
Okay. Do you have any additional questions about cleaning or?
I have a dog. Do you think there'll be any problems with that?
So you don't want to leave this like hanging around because dogs like to chew on them. So put it up and away, or if you have like a drawer, keep it in there. It's kind of big though, so maybe like on top of a nice, well, just anywhere your dog can't get it.
Okay.
So it doesn't chew on it.
And then if it starts to hurt or anything, what should I do?
You can go ahead and if it hurts after the first, well, does it hurt now?
No, it feels fine right now.
Okay, so we'll keep this on here for about 10 minutes and see how it feels. And if we need to make adjustments, we'll make some. But if you sleep with it throughout the night and you wake up and it's just uncomfortable, you can go ahead and take it off and give me a call, and we can make a time for you to come in and make those adjustments.
Okay, great. Thank you.
Mm-hmm.
Just some additional tips that we have for making this specific orthosis is when you're measuring out for the pattern, just making sure that you're measuring from the just distal to the humeral head all the way down just proximal to the wrist, making sure that you're flaring out both of those ends so they don't dig into the skin and still allow for that flexion at the wrist. Making sure that you're also smoothing out those interior edges along the length of the orthosis, as well as making sure that you're cutting the edges out to an angle, especially the area that would go into the axilla, because we don't want a part of the orthosis digging into the armpit of the patient, because that would lead to extreme discomfort.